Hello, welcome to this video. Thanks for tuning in. I'm Dr. Robert Jason Grant, and we are talking about the subject in this video of advocacy, specifically advocating for our neurodivergent clients. So there's a lot we could talk about. This is a big topic. And we're not going to talk about all of it, and we don't want to go on with this video for hours. So we're going to keep it short. And I really just want to hit three main points to understand and to be thinking about advocacy. And then talking a little bit how you can dive deeper into this topic in the work that you do. So the first point is to think about and just get into your awareness that advocacy really is a part of the work that you're doing with neurodivergent children. It doesn't matter what your position is in their life as an adult. If you're a parent, you're obviously a first line advocate for your kids, for sure. Maybe the most important advocate. But if you are like me, child play therapist, if you are an occupational therapist, speech therapist, if you are the second grade teacher of a neurodivergent child, if you're an adult in a role with the child, you're in a space to help provide advocacy for that child. And regardless of what your other goals are, maybe your primary directives, advocacy should be a part. You really should be thinking, I'm also here to help with advocacy if that's needed, because those advocacy efforts do relate directly to all your other goals with the child. It's that important in the neurodivergent child's life. So just to be thinking about advocacy as part of the goals that I'm putting together and helping this child with in the role that I'm in with this child. That oftentimes looks like advocating for the child in other spaces. For me, that might be, wow, I see that a lot of the dysregulation this child is having is because of their school setting. And if they could get certain supports, if they could get certain accommodations, if they could even just get better understanding of how their dysregulation works at school, maybe something put on a 504 plan. I mean, there's all kinds of ways the advocacy could go. But if I see something like that needs to happen, then going and trying to advocate in the ways that I can to help make that happen. That would be the same if you were a speech therapist, occupational therapist, the same if you were a teacher in the school where you see it happening. Advocacy can really be present for you for a lot of different things that are going on in the child's life. I've went in and done advocacy work for kids in the churches that they were going to, for summer camps they were going to, for school settings, for medical settings. I've done advocacy work with their pediatrician, like just how to have that process go better and better understood for the neurodivergent child. Trust me, there's plenty of places to advocate, and just getting in that mindset that you can be a part of that and probably should be in your work with this neurodivergent child. Second point I want to make is part of this also is incorporating teaching children, teens, how to be advocates for themselves, self-advocacy. And sometimes if you're very versed in this, and maybe the caregiver is not, teaching caregivers how to be advocates for their children. So maybe part of what you're going to do is provide training, psychoeducation to help caregivers and the child client themselves learn about advocacy and how to advocate for themselves. Self-advocacy and advocacy goals are one of the all the time goals in the AutPlay therapy framework. We work on a lot of mental health needs, whatever the mental health needs are of the neurodivergent child. But one of the all the time goals is looking at advocacy and what do we need to set up as advocacy goals as well. It's that important. And sometimes that's teaching the child about advocacy or teaching the caregivers about advocacy. The third point I want to make is sometimes advocacy doesn't produce anything. This is what we don't want, but it is a reality. And when you're doing advocacy work, when you're teaching other people about advocacy work, you have to help them understand this point. This point has to be a part of the process that you may be absolutely right in what you're advocating for. And you may actually be doing a really good job advocating, and the people, system, whatever it is on the other side, still shut you down. They close the door. They don't listen. They don't care. They don't whatever. Your advocacy work doesn't get the change you were looking for. We know this is a reality when we do advocacy work. I've experienced this, unfortunately, many times that the door has been closed on me and nothing happens. There are many, many times that great things happen and change happens and things get better for the neurodivergent child. And of course, that's why we keep advocating. So it's about being prepared that you could run into people not listening or responding to your advocacy efforts. Even if that happens, you don't stop advocating. The main point of understanding that could happen is that when it does, it doesn't shut you down. You keep getting up and you keep advocating, and you make sure that you keep doing this in spite of the fact that you know, and you are going to experience sometimes, that it doesn't produce what you're looking for. So those are just the three main points I want to share in this video. I think it's good if you're thinking, I'm not really sure I know how to advocate or be doing advocacy work, to learn more about that. A couple of places you can go. First of all, you can always go to the AutPlay Therapy website, and you can register for a consultation with me or another AutPlay consultant anytime. And if you want to talk specifically about advocacy efforts, we can do that with you. Another place you can go is just online and find some good, maybe advocacy trainings or advocacy books that are focused on advocating for neurodiversity, advocating for neurodivergence. There's a lot of that that's available, and just brush up on your skills and your awareness of that. Well, I hope you found some of this information helpful. Thank you for watching. Please give the video a like and also subscribe to our AutPlay YouTube channel. Thank you. Take care.